We had a story about a girl in Colorado that did medical tourism, which I am so against medical tourism, especially out of the country, but even in the country is a bad idea. And I think we have it. Do we want to run the segment?
Yeah, can we go ahead and run that clip?
Every year, around 14 million people travel across the world to receive medical care, seeking other cities than their own to go under. Well, tonight, Karen is sharing one Colorado woman's warning after she hopped on a plane for a mommy makeover in Miami.
2 weeks earlier, she and her family were in Miami, Florida. She'd found a board-certified plastic surgeon at Seduction Cosmetic Center who would perform what's often called a mommy makeover.
I was looking for a better body for, especially after 4 kids.
The family had arranged to stay for 5 days following the surgery. There were early signs of problems with the incision, which had turned hard and black. But Miriam says doctors told her it was just dry skin and sent her home to Colorado with an antibiotic ointment.
I was like, nobody's willing to touch me, not even in urgent care. What's going on? They are telling me that it's necrosis.
She says while the out-of-state cosmetic center continued to deny any problem, her stomach felt as though it was eating away at itself. Desperate, she reached out to Dr. Samir Hassan.
Not everyone's going to just say yeah, because 1, they're afraid of liability. 2, they don't necessarily always know what it is.
Despite his own concerns, he agreed to help. He found the necrosis was at her abdominal wall and would soon reach her organs.
She potentially would have ended up in a hospital.
Miriam has since had multiple surgeries to fix the botched tummy tuck and has spent countless hours searching for some way to hold the surgery center accountable. Attorneys saying we will not be able to help you.
It really depends, because Florida does not necessarily require its doctors to have medical malpractice insurance.
Raj Chauhan is a legal analyst for CBS Colorado. He says attorneys may be hesitant to take these cases because without malpractice insurance, they say it is just not economically feasible. For Miriam, she signed a document that explained that risk, and every attorney she contacted refused to look at her case. Still, Florida continues to see a jump in cosmetic tourism every year, with out-of-state patients flying in from across the country to go under the knife. Many don't always know what they're getting into.
Most of the people who are marketing themselves as plastic surgeons, they're cosmetic surgeons, and that means you didn't have to go through plastic surgery training.
The appeal largely comes down to cost, which experts say should be your first red flag. While Miriam did research the center online, she found only positive reviews, which she now believes might be fabricated. Today, she struggles to lift her children at times and is fighting a new anxiety about her body.
I wake up in the middle of the night, being traumatized, hoping that it's not ripped open again.
And while she may never see justice in a courtroom, she believes sharing her story will serve as a warning to others.
And stop them from what they're doing.
Pretty crazy stuff. What's wild is that's not even like one of the crazier stories that I see. Like that, the reason I use that one is there's a lot of really good information to learn from it. But as far as like bad outcomes, I mean, there's way worse than that. I mean, you guys probably look at those pictures and like, this is...
I'm like, that's disgusting.
Yeah, this is the worst thing. But there's way worse things that happen out there. This one is good though, because there's that news article brought up so many just great points and educational things to know. And I mean, I don't know how far you want to dive into medical tourism, but I mean, the big problem that this poor patient had is, she went and had a major surgery, and then she leaves the location where her surgeon is 5 days later and starts having problems, and she's got no one to help her. And, a lot of plastic surgeons are reluctant to take on other people's complications, because there is that liability part of it. I do it all the time because I just feel bad for these people, and, I try to help them. But you really can get into a bind if you go out of the state to have surgery. And also, like, that place where she went, I mean, you're going to a place that you're not going for a specific doctor. You're not going to Bruce Herman there. You're going to that corporation that is basically a mill of running patients through. And that one Dr. Hassan was mentioning that, it may not even be a board-certified plastic surgeon, and that's absolutely true. It said that hers was, and I actually looked that place up, and they have a mix of actual plastic surgeons and non-plastic surgeons doing the surgeries. So there's just a lot of, like, problems that patients find when they go out of a state to do a surgery like that. And I think what brought us to that was you talking about the Google reviews, and that's totally true. I mean,
they had over 2,000 reviews, and most of them are positive. You know, and
I mean, there's ways to suppress those things too, and inflate them. I mean, that's where it just gets so hard for patients to know, you know, who's good, who can I trust. You know, as far as like what I would recommend, you know, people do, and this is mostly for plastic surgery. I mean, I know my wheelhouse, of course, like, you know, but making sure that your doctor, you know, especially with plastic surgery, is board certified by the right board. You know, there's only a few boards that are recognized as being legitimate. And so for plastic surgery, it's the American Board of Plastic Surgery. But there's like a cosmetic surgery board, an aesthetic surgery board. I mean, they'll give those boards to almost anyone. I mean, they'll give them to non-plastic surgeons. So if they'll give them to somebody who's not properly trained, what value does it have?
Right.
And so, yeah, I mean, doing research on your doctor is critically important, but you have to be educated to even do that. And
that brings me to a question for you. You know, this is basically what Texas Best Docs does is an asset. It adds to it. So you can look up on Google, but then you can take another step and you can look up on Texas Best Docs just by writing in the doctor's name, because, you know, you may not, you may live in Colorado and go to Florida for surgery, or you may be there's a lot of transplants here in Dallas where you don't have a doctor and you don't know who to go to, and you've got to search. And, you know, as we were talking before, there's a DFW plastic surgeon that has 5-star reviews like that and can't be alone in a room with a female patient. So it's like, you know what I mean? To know those things, you